echoing on your end?
No echoing on my end.
Okay, beautiful. So I can, all right. We we'll make it work. We're live.
You're
We're live.
live.
Yes, we are. Hello, everyone. Good afternoon, good evening, depending on when and where you're watching this live. This is Tolu Olabinton, Dr. Olabinton. I help people live long and well because I believe the quality of life is just as important as the quantity of life. I want to apologize for a little delay. We have been here on time waiting. There's just some technical issues, but we're here. If you are watching live, please hashtag live. If you're watching replay, hashtag replay. If you have a friend that could benefit from this, please invite them. I am honored and delighted to have I would say we're in similar circles. We're in class together. I'm a big fan of her work. I kind of stalk her a little bit on social media, kind of seeing her posts, and
I did
that's why
not know that.
that's why I was excited to have you on here today. But thank you so much, Dr. Chhaya Makhija. Did I pronounce that right?
Yes, absolutely. Yes.
All right, awesome, awesome. So thank you so much for coming. I appreciate you, Doc.
Thank you. And I appreciate likewise the feelings for all the work that you're doing for your audience, for your patients, and for all of us.
All right,
Thank you for
awesome.
having me.
My pleasure, my pleasure. Now, today we're talking about what is intermittent fasting and practical tips on how to start. So before we go ahead, Doc, I know you're a triple board certified physician. You're a specialist in internal medicine, diabetes, endocrinology, and metabolism, and of course, I love it, lifestyle medicine.
Mhm.
Could you please introduce yourself to us, who you are, what you do, and why you do what you do, Doc?
3 questions. Okay, so thank you for introducing. Yeah, this is Dr. Chhaya Makhija, and I am, yes, a board certified endocrinologist and lifestyle medicine specialist. Um, I reside in California, and I'm also the founder of my practice, which is called Unified Endocrine and Diabetes Care. I have one location in Fresno, so that's where I'm right now. And then my second location is in the Bay Area. One thing that makes me very proud that my private practice is the first direct care practice in the state of California, integrating both endocrinology care as well as lifestyle medicine and providing care to all the patients or anyone who needs me in the state of California.
Awesome.
And then
Awesome.
you asked me, what do I do?
Why do you do what you do?
Yes. Um, if you had to talk about being a physician or a doctor, as much as I know myself, always wanted to be a physician, and the dream of entering into medical school. Endocrinology specifically is because I love the collaboration. So I'm not a specialist who will just look at the heart or the gut or the foot or the eyes, but it's multiple organ systems. And the beautiful part of the multiple organ systems is that there is a crosstalk. There is a constant collaboration with each other to bring about that unification, to bring about that homeostasis, a balance. And what I'm talking about is we have endocrine organs in our brain. You have thyroid, you have ovaries, testicles, you have adrenal, pancreas, so much in the gut. So all these are having this constant crosstalk, which makes it complex, but very, very interesting for me. And that's what I enjoy learning as well as teaching my patients. Why do I do it? So that's my passion, endocrinology. The lifestyle medicine part of it has been in the last 5 years, and that is because endocrinology is a big field, and most of it is metabolic diseases, which we'll get into the details. But every American guideline will talk about lifestyle interventions as the first step for our patient care. But it's not talked about in the medical office visit. It's barely discussed in the exam room. And there's barely time for physicians or healthcare professionals to discuss it with their patients. And it's poorly reimbursed by the health insurances. So that's why I've incorporated both of these in my field, adding on to the crucial aspect. The goal in my field is time spent with my patients.
Mm,
So
mm.
that's how this practice of unified endocrine and diabetes care was created That's where it was born.
Awesome. I love what you do, and thank you for doing this and for advocating for lifestyle changes as a way to help patients live long and well. So this is, I like your triple board status. Powerful.
I believe you have the same status, right? The lifestyle medicine.
Yes, 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 definitely. But Doc, let's talk about intermittent fasting. So our topic today is intermittent fasting and practical tips on how to start. Interestingly enough, I had some clients today who I said, "Hey, join us live because we're talking about this." But
Mhm.
what is intermittent fasting and how does it differ from traditional dieting?
Sure. So, just as a terminology suggests, intermittent and fasting. So, I, as a human being, am fasting for periods of time and it's intermittent. And what is it alternating with is the feeding period. So, as
Okay.
simple as intermittent fasting. Is this a dietary approach? Not really. It's more of a strategy, it's more of a popular strategy, I would say, which can be incorporated in our lifestyle rather than thinking that it is a specific diet or it's a fad or it's a trend.
Mm-hmm.
So that's the difference between paleo, Atkins, keto diet, Mediterranean diet, but you're actually designing a way and a time of eating and fasting, which can be almost which it translated into your lifestyle.
Okay. Now, why should someone consider intermittent fasting? Now, I'll be honest with you, a lot of people tend to want to do this for weight loss reasons.
Mhm.
But is there science behind intermittent fasting and weight loss? Is it worth it? What are your thoughts?
Sure. We should go back a little with where did it come from, right?
Okay.
So, just a brief history is we as humans have evolved over the centuries, right? And the access to food in this era is in abundance. You look right, left, you can find food. You're waiting for the checkout, you will find some snacks. There is so much packaged foods. And of course, the delivery is so easy and simple, right? On the other hand, we have gyms for workout or we have exercise routine, but our physical activity in those 24/7 period is limited just because of the jobs we are doing, the demands of the technology, the screen time. That did not exist for our ancestors. So our ancestors had specific times to eat where they hunt
Mm.
for food, they feed themselves, and then they're back to hunting or resting. So they had a good design of fasting and feeding themselves. In general, our body is growing when we are feeding ourselves. So your insulin levels are high because you're eating, you're growing, your growth factors are elevated, you're producing more hormones, you're producing, synthesizing proteins. When we are in the fasting state, that is not feeding ourselves, our
Hmm.
body goes into a different mode where it's utilizing your glucose, which is come from food, and it'll constantly utilize it. So your cells are hungry and they're utilizing it as fuel.
Okay.
After 8 to 12 hours, more specifically 12 hours, if you haven't fed yourself, now there is a very important scientific term that we talk about is metabolic switch.
Okay.
So just to give you an example, if you're driving a hybrid car, so I have my car, it just gives me 20 miles on electricity and then it switches to gas, right? So the metabolic switch is kind of similar. For those 8 to 12 hours, the body is utilizing glucose for energy
Hmm.
and it's utilizing most of it. By the end of 12 hours, what it's going to use for energy is breakdown of the fatty acids from the fat cells called the adipose tissue. And it produces another source of energy, which is called ketone bodies. And
Okay.
now these ketone bodies are being utilized by all your cells, including your brain cells, your neurons, to help you fuel. That's where the positive impact is. It helps us to repair our cells. It helps to regenerate. It helps to reduce inflammation. It helps to reduce our free radicals, which are basically damaging to our cells, and a plethora of positive benefits, which have shown related to aging in rats, not
Mhm.
as much as in humans because we don't have as many studies. But the point is, think about fasting as a way to heal, and think
Mm.
about feeding as providing your energy and for growing. So your cell growth, your for adolescents, for younger individuals, for their growth hormone. So that's the metabolic switch, which is occurring between feeding versus fasting state. But this metabolic switch can be only obtained when you're fasting for more than 12 hours. So
Ah,
that's the science behind intermittent fasting, when we'll dive into, what kinds of intermittent fasting and why the hours of fasting are important.
okay. So that's going to be my next question, the most common methods. And I like that you highlight that 12 hours greater is the
Correct.
spot, because
Yes.
some people say I go to bed early, so that works. So okay, that's good. So let's talk about the different types of fasting. Like, which ones do you recommend as far as intermittent fasting, the on food and off food cycles?
Sure. One of our, especially if there are physicians or healthcare professionals, New England Journal of Medicine has an article. It's been a few years, but more commonly are alternate day fasting. The second one would be 5 by 2. So, 5 days you're eating your regular, and then 2 days of the fasting period, which can be a specific time interval. The most well studied and more popular is the time restricted eating.
Mm.
So, you could have a fasting window between 8 to almost 18 hours. And then the feeding window translates into almost 4 to 8 hours. Personally, I would first talk about, which I still do, is can you improve the quality of your food? So
Mm.
don't forget that you have to first focus on what am I feeding myself. The law of feeding yourself less processed foods, less packaged foods, um, trying to rely on your fruits, vegetables, beans, lentils, nuts and seeds, whole grains is like my mantra for all my patients, no matter what they're coming in for. And then comes the understanding of what their routine is. Are they in graveyard shifts versus are they working during the daytime? What is their age group? What is their BMI? Is there any hidden eating disorder that I am worried about? What metabolic conditions like prediabetes, diabetes, obesity, fatty liver disease, hypertension, high cholesterol, and the list goes on. And now if I had to really make it even simpler for them, I can't think about shopping, I can't make a list, I can't count calories. So then you start talking about intermittent fasting. Simple. Can you just eat between 7 a.m. to 7 p.m.? That's doable. You will incorporate 2 meals, 3 meals, and then once you're getting used to it, can you extend that fasting period, which is from 7 p.m. to 7 a.m.? Can we extend it in the morning by an hour?
Mm.
Now, during this fasting period, you're more than welcome to have water. Some of them say, okay, for non caloric beverages. I do not recommend it at night because you're still, so say if you're having caffeine at night, that there is still a rise in blood sugars.
Mm.
Caffeine tends to cause hyperglycemia or excursion of blood sugar. But in the morning, if you wanted to have black coffee, no milk, no sugar, no creamer, then that's still doable and extend your fasting. So time restricted eating could be, 16 hours of fast, 18 hours of fast, starting from 12 hours to 18 hours. Some of my patients prefer 22 hours. I usually don't recommend, but they feel great with it just because you need that physician support. You want to make sure
22
that
hours
their
of
medical
not,
conditions are addressed.
22 hours of not eating. That's the cycle of not zero.
Yes.
Wow.
So
Wow.
yeah. They would rely on 2 hours, make their meal, and not necessarily stuff themselves, but get their calories from there. I have a
Okay.
handful of those.
Okay. So my question now is, will it slow down your metabolism when you, because that's one of the biggest concerns, like, oh, it slows down my metabolism because your body says, oh, I guess we're not eating so much, so it cuts down how quickly it breaks food. Is that correct, doc?
Hmm. Yes, in some individuals. And that's why intermittent fasting is not for everyone. I am not a big proponent of it. I use it as an added tool, as a resource. And it's a shared decision making that is it worth a trying. So, what Dr. Tolu is trying to actually, probably you've experienced in your real patients, and that's why you're asking that if you're already taking a low, being on or on a low caloric diet, and you're not losing weight, right? And now you're thinking about intermittent fasting, you may end up eating even lower and lower calories, less nutrition. Your body may think that you're in this starvation mode, and it may just try to conserve all the energy. I'm just simplifying the science right now. So if it's going to conserve the energy, you may not burn the fat or the adipose cells as much. And I commonly see this in perimenopause, menopause, as well as polycystic ovarian disease patients, because there is such a haywire imbalance between estrogen, progesterone signaling, the LHFSH, the pituitary signaling, or they may be an undiagnosed sleep apnea in these individuals, which makes intermittent fasting not applicable.
Mm, mm. Okay, that's fair.
Yes,
That's,
yeah. And whenever we talk about intermittent fasting, it's very important. Again, I'll focus on the quality of the food that we are having. Don't have this wrong takeaway. I could eat anything. I could eat all the McDonald's I would want because I'm eating for 6 hours. It will
wonderful.
give you short term goals. You may achieve weight loss. You may have improvement in your insulin sensitivity, in your cholesterol, but it's not going to be sustainable in the long term because the quality is still poor.
Okay, so the whole idea of intermittent fasting is not, I tell my patients this, is not to eat whatever you want. It's just to kind of trick your body into going into fat burning mode.
So
For
true.
most,
Yes.
I found that, telling people not to eat after 7, I've actually helped them to be more aware of how much snacking they do at night.
Mm-hmm.
And so that's sometimes results in weight loss. But I have someone who's watching who says, "Oh, I've been doing intermittent fasting. I feel great." Doc, can you talk about some of the benefits, the tangible benefits of intermittent fasting when done right?
Yes, absolutely. If you're in tune with your body, you have this intuition, you have the body awareness, the food awareness, then yes, it might be very, very beneficial. I personally will go for 12 to 14 hours unintentionally because now it's my lifestyle. And patients, as well as in our studies, there's so much improvement in insulin sensitivity. There is deep prescription of medications that is possible. Your metabolic markers, your insulin levels, the CRP levels, the triglyceride levels, there is so much improvement or normalization with these or with this specific approach that patients love the progress. uh, Personally, patients will tell me the energy levels have improved.
I've heard that.
They are, in perimenopause, menopause, if they're on the right medications or hormone therapy, as well as implementing these, the brain fog, there's a dramatic improvement there. Waist circumference is definitely improves, right? And the main important thing, I do body compositions. I see massive improvements in visceral fat, and visceral fat is the bad fat surrounding our organs, which is a risk factor for other diseases. So definitely in all the spectrum, including there have been good studies for rheumatoid arthritis, for
Mm.
inflammation. with the benefits. And then I remember in fellowship, we had looked through multiple sclerosis and the improvement in the markers there.
Wow, awesome.
Yes.
So this is a good. I'm actually a big fan of it within reason. I don't do the extremes. So just that small window. I eat healthy. You know,
Mm-hmm.
uh, healthy, wholesome meals is not an excuse to eat whatever, and make sure you stay hydrated. And also, like you mentioned, depending on what kind of job you do.
Mm-hmm.
Um, would you say for those, does it matter the timing of the 12 hours? So for those who work late shifts.
It does. And
Mm,
why it does is because of our body, how it follows the sleep and wake cycle, the circadian rhythm. And in, again, simple words, in endocrinology, our hormones like cortisol, growth hormone, testosterone, they tend to peak early in the morning. And that's when we check these levels. And gradually over the day, 4 p.m., past 6 p.m., they're declining. Okay, that's normal physiology.
mm,
Similarly, for us, our gut microbiome or the good bacteria that we have in there, as well as the digestive system, how we process the feeding interval is best studied and ideal during the sunset period. And then, of course, you can extend your fasting during the daytime. But feeding yourself, following that circadian rhythm, is more beneficial rather than feeding yourself at night, that is after sunset, and fasting during the day period. This
okay.
is more seen in the literature, that there is still benefit by feeding yourself during the daytime rather than nighttime.
Okay. All right. Now, who should not do intermittent fasting? Of course, we advise that everyone seek counsel from their own doctors, but are there people you say, yeah, I don't think this is a good idea?
Sure, yes. So, pregnancy and breastfeeding, it's not necessarily a no, but you really need to take the right calories because you're feeding two people, right? I have to assess my young adults for eating disorders. So I
Mm,
have to raise my radar quite high. And I may not come to know about their eating disorder the first visit. It may after first few visits. So I don't discuss or entertain intermittent fasting because it might precipitate it, especially
mm,
anorexia. The third ones are my younger patients who are studying and they're dealing with PCOS or pre-diabetes because they follow you really well. I'm talking about my patients, and they will just not eat because they miss the time. And now they're fasting for 24 hours because they're waiting for the next feeding period.
wow.
Yes, so that knowledge has to be conveyed rightfully, and both patient and physician should be deciding, is this right for me, rather than putting it as a blanket approach.
Okay.
Yeah. The fourth ones are my patients with osteoporosis. So,
Mm,
women, and this is not talked as much, but my patients with lean BMI, they're already at risk for bone loss.
mm,
And past age 50 or past age whatever their menopause age is, it could be early menopause or 45 to 55. If they already have low BMI, they're already on the lower caloric intake or barely normal caloric intake. If they lose more weight by this approach, there is direct bone loss,
mm.
right? So one has to be very mindful and very aware as a healthcare professional. What are you approaching? What's your goal when you're talking about intermittent fasting for this particular patient?
Okay, so being mindful of goals um, for each, the choice to do intermittent fasting is very, very important. You got to find the right fit. I didn't think about it with the osteoporosis, but that makes sense. Thank you, Doc. Wow, it's
Sure.
it's literally a minute to 7. I didn't get to go through all my questions, but this has been very, very useful. And I have people who are watching who are like, wow. You're very helpful. You explain it in a way that's understandable. You helped us understand that intermittent fasting is not for everyone and there are tricks to the trade. But Doc, where can people find you to get more information, to follow you perhaps, and maybe even invite you to come speak on their platform? Where can people find you, Doc?
Sure. Oh, that would be great. So you can find me on my website, which is unifiedendocrinecare.com. If you're in California, I would love to see you as a patient and help you in your journey. If you are on social media, my handles are Chhaya Makhija MD on Facebook, on Instagram, as well as YouTube. And you're more than welcome to DM me if you find me on these channels.
Awesome. And I'm going to put all that information at the bottom of the screen. But thank you so much, Doc. I appreciate you taking the time to come share with our viewers, to enlighten them on the benefits of intermittent fasting, the things to watch out for when considering intermittent fasting. I appreciate you big time.
Thank you so much. 25 minutes for this great topic, but I thank you again for your audience for listening
Oh,
and for
my
your
pleasure.
amazing
It was
questions.
28 minutes.
Okay.
28 minutes. 28. Oh, this was good. And thank you all for watching. Those of you who watch live, those who watch and replay. As always, please make sure you have appointments with your own caregivers so you can come up with a plan that's the best fit for you. And as always, sharing is caring. You know someone who could use this information, please share this with them. And as always, if you or anyone you know is looking for an awesome, a thorough, and a compassionate family physician who will help you live long and well, I am she. Thank you so much. And thank you so much, Doc. I appreciate you.
Thank you.
All right. Bye, everyone. Have a good one. Have a good one.